we zitten.
Ladies, please be seated.
Well, good afternoon, everybody. In this beautiful sunny afternoon today, and I hereby open officially this academic ceremony in which Ms. Caroline Daccache will defend her academic thesis entitled A Health Economic Evaluation Guideline in Low and Middle Income Countries, a case study from Lebanon. May I invite you to present a summary of your studies and the conclusions of your studies in the next 15 minutes, and I'd like to give you the word.
Thank you, dear Prorector. Dear Prorector, members of Corona, members, colleagues, family, and friends, today I will present the main findings of my thesis entitled A Health Economic Evaluation Guideline in Low and Middle Income Countries, a case study from Lebanon. According to the World Health Organization expenditure database, the healthcare expenditure around the world has significantly increased. This increase, coupled with several factors, such as the new innovative technologies, the high burden of disease and chronic disease, the high patient expectations, the aging population with limited and finite resources, put the healthcare system around the world under pressure, which highlights the growing need to have tools to guide our decision-making and to allocate our scarce resources. Health Technology Assessment, or HTA, has emerged as a tool to guide decision-making. And as defined by Rourke et al., Health Technology Assessment is a multidisciplinary process where we will adopt explicit methods to determine the value of a health technology. What do we mean by value? We mean the clinical effectiveness, the cost and the economics implications, the safety, ethical, social, legal, environmental aspects. So to determine the economic value of a health technology, we need to conduct economic evaluation studies. Economic evaluation is the main domain for HTA, and it aims to compare different interventions considering their cost and their outcomes. Conducting economic evaluations requires the development of a health economic evaluation guideline to standardize these economic evaluation studies, to enhance the quality of these economic evaluations, and to minimize the methodological uncertainties in these studies. So ultimately, this will lead to guide a better decision-making. Since the 1980s, economic evaluation guidelines and economic evaluation tools have been applied in many high-income countries, such as the Kingdom of Netherlands, Canada, Australia, Germany, and the UK. As well, the interest in the economic evaluation guidelines has increased in middle-income countries. However, Lebanon, a lower middle-income country, doesn't have yet an economic evaluation guideline. Our thesis aim is to develop a health economic evaluation guideline for Lebanon. Lebanon healthcare system is a fragmented system with 6 employment-based social insurance schemes having different tariffs and different coverage. It includes public, private sectors, and international organizations, and the Ministry of Public Health is the regulatory authority and the responsible party for developing health system guidance. Additionally, the Ministry of Public Health, since the 2016 and with the Lebanese National Health Strategy Vision for 2030, underscores and emphasizes on the need to have regulations to support decision-making in considering cost-effective interventions. Lebanon healthcare spending has dramatically increased from 2005 to 2019, and even after the 2019 economic and the financial collapse, 55% of the population could not have access to essential healthcare services, and 40% lacked health coverage. So while we aim to develop our economic evaluation guideline, we identified several gaps which brought out our thesis chapter objective. With the lack of a comprehensive economic evaluation overview in low and middle income countries, we systematically reviewed the latest official version of economic evaluation guidelines in low and middle income countries, and we explored similarities and differences in their content. We followed the preferred reporting items for systematic reviews and meta-analysis. The search was broad with no restrictions on language and publication date. The search strategy was validated by a medical information specialist. The full text screening and the data extraction were done independently and in duplicates. And we identified 13 economic evaluation guidelines, none in low-income countries, 3 in lower middle-income countries, 9 in upper middle-income countries, in addition to Mercosur. And we found that 50% of these economic evaluation guidelines were not mandatory. Some essential key features were not addressed in these economic evaluation guidelines. Contradictions existed, and differences in terminology does not exist between these guidelines. Between these guidelines. Addressing the absence of a published comprehensive literature review of the development process, we first systematically review the responsible party engaged in this development. We systematically reviewed the composition of the development team, and we reviewed the methods adopted in this development. We found that 14 EEGs were identified in middle-income countries. The Ministry of Public Health was the responsible party in the majority of these guidelines, and the majority of these guidelines did not explicitly report the composition of the team involved in this development. Additionally, we identified 4 steps inconsistently adopted and reported in these guidelines: conducting reviews, organizing workshops, and asking support from international experts and international organizations. Second, we conducted a quality assessment by adopting the participants and the methods domain of the Agri-HS tool. The Agri-HS tool is a tool developed by the Agri enterprise to assess the quality of the health system guidance. And we found that countries with the lowest score for these 2 domains, the participants and the methods, had the most methodological weaknesses and gaps already identified in our previous systematic review. With the need to develop the national economic evaluation guidelines, we transparently report this development process. We closely followed the development process proposed by the World Health Organization on developing health system guidance, to set a guideline development group, to identify the rationale and the scope, to search for evidence, to translate the evidence into recommendations, and to consult international experts. Lebanon doesn't have an economic evaluation guideline, so the Lebanese Health Economic Evaluation Guideline, or LEAG, will be a tool for policymakers and payers to guide their decision-making and to wisely allocate their scarce resources. Will be a tool for the pharmaceutical companies to assist them in the submission of the economic evaluation, and will be a guide for the researcher to conduct their economic evaluation. Additionally, LEAG will support the society as well as the patient to have better access to health services. Our guideline development group is composed of the coordinator, experts in health systems and representative of potential users, an expert in health technology assessment and health economics, expert in research synthesis and knowledge translation, in addition to our international experts from Maastricht University, Professor of Health Technology Assessment, and Associate Professor of Health Technology Assessment and Health Economics. To search for evidence, we conducted 2 systematic reviews. The first one was the Economic Evaluation Guidelines in Low and Middle Income Countries, published in 2021. The second one was the development process of these EEGs, published in 2022. In the deliberative process, 16 Lebanese stakeholders were involved in this development process. They were from multiple sectors with different disciplines and backgrounds. and truly with various levels of expertise in health economics. The deliberative process consists of filling surveys, conducting interviews of up to 60 minutes, and organizing a workshop to reach consensus on the discrepancies already identified from the interviews. And in the absence of an economic evaluation guideline in Lebanon, we reported the Lebanese Health Economic Evaluation Guideline recommendation and reference case. The Lebanese Economic Evaluation Guideline reference case includes 3 general characteristics and 19 key features. However, to adopt all these general characteristics and all these key features, several recommended actions are intended to be applied and to be addressed. To make the League a mandatory guideline, it is recommended to issue a regulation specifying this mandatory use. All the population and subgroups and the comparators for the therapeutic indication in considering the health intervention should be considered and identified in the economic evaluation study. Then it is preferred to publish the Lebanese disease management pathway, where we can identify the target population and the comparators. The preferred source of data on cost should be from the Lebanese reference prices. So it is a necessity now to develop our Lebanese costing manual or the Lebanese reference prices. The EQ5D in League is considered as the preferred generic instrument to derive utility. So we are in need to develop our EQ5D 5L Lebanese value sets. The discount rate of 3% in the Lebanese Health Economic Evaluation Guidelines is considered from the discount rate proposed by WHO for low and middle income countries. So it is preferred to have our national discount rate. In the absence of a willingness to pay threshold to guide decision making, it is recommended to develop our quality league tables and to set our national willingness to pay threshold. Then, League will be the first national economic evaluation guideline for Lebanon, supported by the Ministry of Public Health. It will be available at the Ministry website for public consultation, and finally, the League final version will be available afterwards. Additionally, in this thesis, we addressed the need to explore what are the barriers and facilitators of implementing League. And so for a successful League implementations, we aimed to identify the barriers, we identified the main facilitators, and we gathered insights from our Lebanese stakeholders. In this initial exploration, we identified that 100% of the participants agreed on the importance and the necessity of League development for Lebanon. The majority considered League as extremely to very important in decision making. However, only 25% strongly agreed that League will be applicable as a criterion in decision making. And based on the barriers and facilitators master list already proposed for the participants, the Lebanese participants ranked nearly all barriers as moderately to extremely important, and all facilitators as moderately important. The most important barriers were the lack of the political willingness and the absence of policy network, and the most important facilitators were the strong need to implement League and the acceptability by payers. Additionally, in this initial exploration of barriers and facilitators, we collected data from Lebanese healthcare stakeholders where they proposed their own barriers and facilitators for implementing League other than those proposed in our master list. In conclusion, aiming for a universal health coverage and addressing the UN Sustainable Goal 3, and in a framework of HTA, we need to conduct economic evaluation study. Developing economic evaluation guideline is fundamental. So our thesis provide evidence on the economic evaluation guidelines in LMICs provides a methodological approach that can support guideline developers and international organizations to develop a national economic evaluation guideline. It provides an economic evaluation guideline for Lebanon to support payers, decision makers, pharma companies, researchers, and patients. It provides an initial exploration of the barriers and facilitators for legal implementation and a step-by-step guide for legal implementation. This step-by-step guide for implementing league consists of several steps. Each step should be an independent study, fundamental and essential for the league implementation. We need to make league available for public consultation. We have to set the official version of league. We have to issue a regulation. We have to implement strategies for capacity building. We have to implement awareness programs on the effectiveness of the economic evaluation results. We have to develop the costing manual. We have to publish the Lebanese disease management pathway. We have to set the national discount rate. We have to establish our Lebanese EQ5D value set. We have to develop the quality league tables as well as the willingness to pay threshold. And after the implementation and at the later stage, we have to monitor the league implementation and we have to update the league when needed. I want to thank you, Maastricht University. I want to thank Care and Public Health Research Institute, ISPO Lebanon chapter, our supervisors, our co-supervisors, my assessment committee, and it always seems impossible until it is done. Thank you.
Thank you very much, Ms. Candidate, for your clear presentation. It was well illustrated and also well in time, so that's also important. However, before we start the official questioning of your data, I'm going to introduce some people because also we are online available, so people maybe from your friends in Lebanon can also follow us online. First of all, I'm introducing myself. I'm Professor Steinbusch, the Prorector, and I'm assisted today by Professor Paulus, who is officially the secretary of this event. Opposite of me, we have now, and I have to look now on my papers, we have Professor Helixman. It's not Dr. Helixman, it's Professor Helixman. You should know that in your thesis. He's Professor in Health Preferences and Economics of Prevention. Then we have also Professor Karam, who will be here, and I noticed when I was read your book that you have studied at the Karam University, and I was a little bit confused. How is that possible? But maybe that's something for later. So Professor Karam is a professor in pharmaceutical policy and regulation in Lebanon. Then we have Professor Evers, who is professor of health economics, and finally online, Dr. Rizik, who is involved in the Department of Nutrition and Food Sciences at the Lebanese American University. Saying this, I also would like to mention that we have 5 opponents here today who are going to address questions to you. 3 are here on site, and 2 of them are online available. Saying this, and without further ado, I would like to start with Professor Pavlova. She was also the chair of your assessment committee, and she is Professor of Health Economics and Equity here at Maastricht University, and I would like to give her the opportunity to start questions with you. Professor Pavlova, the word is yours.
Dear candidate, my congratulations to you and to your supervisory team for this important dissertation focused on economic evaluation in low and middle income countries. The topic is highly relevant and has important implications for policy and for research, because the question of how economic evaluation can be applied in low and middle income countries has been around for some time already, but sufficient evidence is still lacking. And your dissertation will be for sure of great interest for researchers and decision makers around the world who are keen on using economic evaluation method. I read your dissertation with interest, and all chapters are very valuable, but I would like to discuss with you the beginning and the end of the thesis. So let's start with the general introduction chapter. The most important part in that chapter for a researcher is, of course, the overall aim of the dissertation. So I read the formulation of the aim, but I was still struggling to understand why is that a research problem. where is the problem that you investigate. For example, your research aim states that you aim to develop economic relation guidelines for low and middle income countries, in bracket Lebanon, and to promote its implementation. But why do you need to develop such guideline? Why you need to look how to develop such guideline? Because, as you also show, there are so many countries around the world, of course high-income countries, but countries who have developed the method. And why do you need to have a different approach if you look at low and middle-income countries? Isn't it the same method? Isn't it the same way to develop guidelines?
Okay. Thank you, highly esteemed opponent, for your comment and for your question. To start, by my aim to initiate this thesis research question, it started from the beginning by understanding the evidence and the need for evidence to guide decision making. I started by a comparative review of high-income countries, how they develop their guidelines. And I was interested because Lebanon already, since 2016, initiated the need for having an HTA framework to guide the decision-making in the Ministry of Public Health. So I was wondering why, knowing that the importance of having evidence tools to guide our decision-making, we don't have yet our guideline. And when I did our comparative review of economic evaluation guidelines in high-income countries, I noticed that we are in need to check how other countries similar to us developed and did in their economic evaluation guidelines. This was the first, at the beginning, to conduct and to start our research question, to identify my research question. Why not to consider high-income countries? Then at the later stage, when we were considering, when we were reviewing the literature, we identified several studies emphasizing on the importance of having national economic evaluation guidelines. Plus, we found that we may have different barriers and facilitators that may be available and faced by middle-income countries, but not faced by upper middle-income countries or high-income countries. And at a later stage in our chapter of the barriers and facilitators, we found that we may have a very similar background, a close background between middle-income countries, but the challenges faced in high-income countries are totally different than those identified and faced in middle-income countries. But we are closed, but the challenges are close between the middle-income countries.
Yeah, thank you very much for this clarification. This, however, brings me to the next question, because you just say that it is context-specific. So the development of guidelines is context-specific. But then you take Lebanon as an example of low and middle-income country. Well, we know that the context is very different within low and middle-income countries. You have completely different capacity, resources. Even if you compare countries with the same economic level but located in African region or Asian region. So why you think that other low and middle-income countries would learn from developing guidelines for the very specific context of Lebanon? We all know that Lebanon is a context which is quite different, especially in the events happening in the recent years, different than other countries also in the region. Why you think others would learn from Lebanon?
Exactly, Lebanon has faced a lot of challenges. However, our study started in 2019 before the economic and the financial crisis. So our aim to develop our economic evaluation guideline already started before the crisis. Regarding the comparison between the Lebanese context and different middle-income countries, our study aimed to provide the evidence on the development process, starting from the evidence with all the steps that we followed. However, in addition to that, we mentioned in our thesis that always we have to adapt this development process to the national level for each country. even if we can follow the same methodological approach, then at a later stage, each country should adapt this economic evaluation guideline and should adapt this methodological approach to its context, specific context.
Okay, thank you very much. Do I have another minute?
Yes, you have.
Okay. Let's look at the end, further in the discussion, where we make these kind of conclusions. You rightfully point to the problem of applying economic evaluation to low and middle income countries, and you have also a chapter exploring the difficulties. But one of the biggest problem is the availability of data. And also good quality data. Even with political will, if there is no such data, it is not possible. And researchers have to compromise, even with beautiful guidelines. If there is no data, we need to compromise on the design. So, do you see any feasible solution in low and middle income country with regards to data availability?
Yes, exactly. Surely we have to follow a strategic plan that will be based on the step-by-step guide already proposed in this thesis, where we have to start by updating the guidelines, asking for public consultation, and having the final version, then to issue a regulation, and then all the steps that were presented regarding the missing of data in the reference prices. We have to develop our Lebanese costing manual and all the Lebanese disease management pathway and all other steps and studies needed to update and provide data to conduct and to implement our economic evaluation guideline should be initiated. And for each step, we have identified our option or our alternative when we cannot have our national data. We can seek to extract the evidence. If we are talking about the reference prices, we can do our micro-costing, micro, macro, or the friction cost methods to collect data, and we will start having our data regarding the EQ5D or for the utility sets. We have now, in 2024, a new study was published presenting the value sets, the utility value sets, adopting the SF6D as a generic instrument. It could be an alternative for the EQ5D 5L, till having our Lebanese utility value sets from the EQ5D 5L.
Yeah, thank you very much for this interesting discussion. And I have no further questions. I'll give the word back to the prorector.
Thank you very much. Then the opposition will be continued by Professor Paulus. She was a member of your assessment committee, and she is appointed as professor in economics of education and healthcare, and I'd like to give her the word.
Thank you, dear Prorector. The candidate, let me start by congratulating you. I think also Professor Pavlova indicated that this is a very relevant and very interesting thesis, so therefore I want to congratulate you, but also your supervisory team, online and on-site. It's quite an achievement. Nevertheless, as you can understand, I also have some questions for you. My first set of questions is related to the process of developing the economic evaluation guidelines. And I want to start by following up on the discussion that you had with Professor Pavlova, where we talked about context. Professor Pavlova asked already, what can we learn from the development of the guideline in Lebanon? What can other countries learn from that? I want to ask you the reverse question. We know also from your literature review there are certain steps that you go through to develop an economic evaluation guideline. And we have, as you saw in the graph that you showed us in your presentation, all kinds of countries which have these guidelines. Now, do you think that we can transfer the development process, for instance in higher income countries, to the development process in Lebanon? Are there the same steps? Do you think that some of these steps are generic? Maybe some steps should be different? I would like to hear your reflection on that.
Okay. Thank you, highly esteemed opponent, for your feedback on this thesis and for your question. To start about the development process, about the generic steps that could be adopted for other countries. All the steps are generic. from setting a guideline development group, but who will be involved in this guideline development group may vary from one country to another. To search for evidence, it is common for all the countries. It is evidence and it is available, and we systematically review this evidence. To translate the evidence into recommendations, it's something that should be country-specific, and it could not be generic, through our deliberative process, where we ask questions our Lebanese stakeholders and we get their feedback. And to translate the evidence into recommendation, through, already we talk about them, and the international support. And the international support is something common. We need the expertise from our international experts, where they can help to stay following the best practice and to stay on the right track regarding health economics and HTA.
So in your opinion, you would say most steps in the process are very generic?
Yeah.
And that there are certain things that should be contextually adapted?
Exactly.
Yeah. Then let me try to proceed on what you said now. You developed your guideline, at least, for Lebanon. And in trying to develop that guideline, you also used experts. Now, I saw in your dissertation that you say that some of the experts, or maybe even a large percentage, has no knowledge of economics or health economics. Could you try to reflect on the implications of that?
Surely we need the feedback of those participants who don't have, we need their perspective about the economic evaluation guideline, even if they don't have an expertise in health economics. We need the feedback of the patient representative group or the advocacy group. We need their feedback, how they see their point of view regarding the guideline and regarding each key feature. In addition, that in our deliberative process, when we were talking about the barriers and facilitators, one of the participants, the patient advocacy group representative, did not accept to set or to rank the barriers and facilitators, saying that he doesn't have a background in health economics. So his answers were based on his knowledge regarding the patient's feedbacks and the patient point of view.
Okay, yeah. So you said, and that was only the patient, or were there also other experts that?
And some experts, other decision makers, even other decision makers who are decision makers and should be involved in health economics and should have expertise in health economics, they showed a little bit of knowledge in health economics. However, a lot of other experts or other Lebanese stakeholders, they were really expert in health economics.
Mm-hmm, mm-hmm. And of course, you then have different experts, I think 16 approximately. And as you say, there's one patient representative, which is, I think, very important. But then you have to arrive at a consensus. So you had a workshop and you tried a panel approach, but not a Delphi panel approach.
No.
Could you indicate why? Because Delphi panels are often used to arrive at consensus. So why didn't you use that approach, and why did you select the one that you now opted for?
Exactly, it was one of the approach that could be selected, the Delphi method, but we prefer to go for the deliberative process using the interviews, using the surveys and the interviews and the consensus workshop, since our sample is small, and we were interested in having a lot of interaction between the participant and the interviewers. We wanted to get their feedback, we want to make some clarifications, we want to validate their answers regarding each key feature, so that the interviewer can have a direct and immediate clarification of the answer of the participant, and the participants can directly clarify his point of view, since the sample of our study was a little bit small, 16 Lebanese stakeholders. It's a little bit small, and we needed to have their insights and their feedback, not only to reach consensus.
Mm-hmm. And were there particular criteria that you selected the experts on? Did they have to meet certain criteria?
We selected all stakeholders that were involved in our Lebanese healthcare system. From patient advocacy group, from ethicists, physicians, pharmacists, ISPOR Lebanon chapter, nurses, ethicists, I mentioned the ethicists, and all sectors were involved in this study.
And and the policymakers or the politicians. I would have expected them to be also quite representative in such a panel.
Exactly. We mentioned this in our last part of in this thesis. We mentioned that the political support or the political involvement will be in the implementation part, and it is necessary to involve our politicians. In addition to that, we mentioned that we need to have awareness programs for decision makers to support them, to let them be aware about the evidence resulted from the economic evaluation results. So the politicians, they were available in the study. We have to provide and to implement strategies for the awareness programs, and we have to implement them, to involve them in the implementation of the League, of the Lebanese guideline.
Is there still time to ask one small question?
A small question.
Yeah. So then it's my last question to you. In hindsight, if you look at your panel composition, would you now, in hindsight, say I missed some experts, I would have added or not added some experts that I did now?
Surely, I did not miss any sector. As a next step, we will have the public consultation. Well, the presentation of these sectors will be bigger. That's why the last step of the public consultation is something very important in this development process.
Thank you very much. I give the word back to the director.
Thank you very much. Then we will proceed online and we move to Professor Heyer. Professor Heyer is Professor of Nursing Sciences at the University of Balamand in Lebanon, and I would like to give her the opportunity to discuss with you. Professor Heyer.
Thank you so much, Pro-Rector. I am delighted to be with you again. You know, Maastricht is a well-known place to me, and I have supervised many PhD students in Maastricht, and I know the system. I'm missing the aula, Pro-Rector, but I'm delighted to be with you. I want to say a few words to the candidates. Caroline, you have done a marvelous job. Your work is very comprehensive, very detailed in nature, and I've learned a lot from you because especially, I mean, regarding this specific topic, and I mean it for research purposes. As a researcher, I've always really looked for ways and means to do an economic evaluation of intervention studies. So your dissertation has given me a lot of things to think about for the future. And I would like to sort of extend my congratulations to your supervisors who are with you today. And I wish you very, very well for the future with this work. And I hope you can do more work together when you come back to Lebanon. Caroline, I think the first question that I have for you is in the introduction. And I'm only out of curiosity, you have done your work outside Europe, but you know the systems in Europe and in the West. So you have not given that part of development of guidelines in the Netherlands. So I was wondering if you can shed very briefly some light on this issue, which should have been really a little bit more highlighted, you know, in my perspective in your dissertation.
Thank you, highly esteemed opponent, for your feedback and for your question. To start, surely the development process of economic evaluation guideline in the Kingdom of Netherlands was of great interest for me. And as I was interested in high-income countries, Netherlands was one of the countries who has a lot of expertise in health economics. They have, if I want to give you a brief history about the guideline in Netherlands, since the 90s, Netherlands started developing their economic evaluation guidelines, and in 2024, the Kingdom of Netherlands already updated their guidelines and they provided a new health economic evaluation guideline for their country. In addition, they updated their the Dutch costing manual for the Netherlands. So for me, the guideline, the economic evaluation guideline for Netherlands, as well as their costing manual, will be a reference guide for me in developing and searching for the methodological approach in each in the health economic practice. This is a brief about the story.
That was my question, very briefly. So I think I want to take us to the league that you have discussed very well, and you are very ambitious, and actually your descriptions are very ambitious in the way it's going to be done. Now, my concern in all of this is that I know Lebanon, and I know what we have, and I know that quality of life data and other type of norm data are at this moment missing in general in the country. So my question to you is, how do you propose that we move on with this type of work without having the essential norm data that anyone would need in developing the guidelines further?
Highly esteemed opponent, just I want to mention that the Ministry of Public Health, since the 2016, already started considering the HTA framework as an essential part and an essential tool. And in 2023, they developed the National Strategic Plan to implement the HTA framework and to have an HTA committee. Then in 2025, after the 2-year review of the work that was done, they mentioned that the HTA is already implemented in the Ministry of Public Health, and having this economic evaluation guideline and the availability of this economic evaluation guideline is a pillar in establishing the HTA framework in Lebanon by the Ministry of Public Health. When we will establish this economic evaluation guideline and it will be available at the Ministry as an official version, we will start, or we can start by now, to follow this strategical plan where we have to start collecting national data, starting from the disease management pathway, then switching to the Lebanese costing manual, which is an essential document to conduct economic evaluation studies in Lebanon, and all other national data needed to conduct an economic evaluation study will be implemented, and we will start working on it one by one.
Thank you. I want us to move now to the research part, because when you were talking about the panel that you had and the workshops and all of that, I missed actually the researchers, outcome researchers that could have been included in your panel as well. I don't want to go into the Delphi method. I would have preferred that, but I think you have answered, you have addressed that very nicely now with my colleague. But I think basically, if you think about outcome researchers and the importance of the input that they can have in developing guidelines, you might want to rethink who to involve really in this part of guideline development for the country. And I'm thinking in particular about outcome researchers, but also educators, because the educators, I think, for me, are essential, because you really need to spread the knowledge about the importance of economic evaluation. How do we do it, and how do we make others interested in conducting such evaluation in the country? So your thoughts only, Caroline.
Yes, highly esteemed opponent, regarding the educators, our guideline development group, even if they are expert in health system and HTA and health economics, 3 are in the education system. We have Professor Karam, which is a professor in the Lebanese University. We have Dr. Rana Rizq, which also an assistant professor at the Lebanese American University. We have Professor Evers and Professor Hilligsman. They are educators in their field.
Okay, how about outcome researchers?
Researchers, directly, we consider the nurses, we consider the physicians, and we consider the researchers and the pharma companies as outcome researchers.
Okay. Well, I was thinking of somebody different, to have, there are researchers who are conducting actually intervention studies in the country and whose main interest is to do economic and cost effectiveness evaluations and the like. And these were not included in the panel that you used, correct?
Pharma companies, the persons that were involved from pharma companies, they are researchers in conducting economic evaluation studies, and they are conducting economic evaluation studies. Okay. So conducting economic evaluation studies, so they consider the outcomes part.
Okay. All right, thank you. Thank you very much.
Okay.
I give the word back to you, Pro-Rector.
Thank you very much, Professor Heer. Then we move to Professor Cody. He is professor. He's also a member of your assessment committee, and he is professor of pharmacology at the Lebanese University. And I also like to give him the word to have a discussion with you. Professor Cordy.
Thank you, dear Prorector, and thank you, Caroline, for your comprehensive presentation and for this novel and very important work developing the Lebanon's Health Economic Evaluation Guideline. As all my colleagues mentioned, that your mixed method approach and your engagement with a lot of stakeholders are very important and was very challenging. So I would like to congratulate you for this work, and also I extend my congratulations to all your supervisors and co-supervisors. Just at the beginning to start, while reviewing your thesis and this important work, I noticed that I was thinking that at the end of the manuscript, I may see a draft that you may present to the Minister of Public Health in Lebanon, a draft of a guideline that you may have it ready to present and to suggest to work on with the Ministry of Public Health. But this part, I didn't see it in your thesis. I know maybe you have a lack of time to develop it and to work on it as an additional chapter maybe, but this at the end was a little bit missing. Do you plan to work on something like that in the future, to develop your thesis and continue by drafting a guideline?
Highly esteemed opponent, for your feedback and for your question regarding drafting a guideline. Drafting a guideline was from the beginning the aim of this thesis, and surely with providing this step-by-step guide where we will start by providing this draft that the Ministry of Public Health is one. It is the first and essential step that should be done after this thesis. So our next step will be to provide this thesis with its outcome to the Ministry of Public Health. It will be presented for public consultations at the Ministry website, and then the final version after the public consultation will be available.
Okay. And my second question is, while you argue the economic crisis that we have in Lebanon, and you mentioned it creates urgency for the League, it also means that the Ministry of Public Health during this crisis or during this period also they have limited resources and staff to implement such changes and complex changes. How do you prevent that such guideline in the future may become a burden that will overwhelm the system at the Ministry of Public Health?
Based on our initial exploration of the barriers and facilitators, having these economic evaluation guidelines is one of the most important facilitators. So it's important to have this guideline available. So this is a burden. It's no more a burden to have this guideline. Surely adopting this economic evaluation guideline is a tool to guide decision making. So it will support the need to wisely allocate the scarce resources of the Ministry of Public Health. So while we are adopting this economic evaluation guideline, it is never a burden. It will be a solution, it will be a support and a reform to guide the resources allocation.
With limited resources that they have, you mean? Regardless. Okay. And talking about barriers and facilitators, I noticed in your in chapter 6, last chapter, in the two tables, table 1 and table 2, where you mentioned the barriers and facilitators, we have as barriers, you mentioned the lack of political willingness to adapt such guideline, but also as facilitator, you mentioned there is high political willingness. So how a barrier like lack of political and as a facilitator high willingness, it's a little bit contradictory. You think we have a lack of willingness, political maybe lack of political willingness or a high political willingness in this part, because you have it as a barrier and you have it as a facilitator. So this contradiction, how you can explain it, please?
Regarding the political willingness, it could be a barrier and it could be a facilitator, because politicians, they are interested to have such a tool to guide their decisions, but at the same time it is a barrier for them because they are interested in their personal interest. So it could be a barrier as a political willingness because they don't want to limit their personal interest, and it will be a high political willingness because they are interested to guide their decision making in their healthcare system.
And on the same question, what specific strategies would you recommend then to engage this resistance if we are going to talk about lack of willingness? So this resistance, but they are critical, as we know in Lebanon, they are critical actor to move forward. So what specific strategies do you recommend?
It is important to engage them in the implementation of the guideline. Plus, what is very important is to implement strategies to make awareness for these politicians, to show them how important it is to have the economic evaluation evidence to guide their decision making, and how these economic evaluation results will guide and will support them in guiding their resources. So it's important to implement awareness programs for the politicians as well as their decision makers.
And do you think you have some resistance from outside the political parties, or like the pharma companies or the other stakeholders? Do you think there is any other resistance coming from any other party?
In our barriers and facilitators study, we found that there is a willingness from the payers to have such guidelines and to implement these guidelines. From the pharmaceutical companies, they were interested, and as we know in Lebanon, the pharmaceutical companies were also always the support for the ISPOR Lebanon chapter and for many other initiatives to implement new strategies and new tools to guide decision making. They were always a supportive system for decision makers in Lebanon.
Okay. And my last question is a little bit about, Lebanon is always in storms, and this will make Lebanon a little bit unique. I'm not sure during your thesis, you prepared your interviews and, during your PhD, during this last 4 or 5 years, we passed by very important financial crisis. I don't know when exactly your interviews and when you met with the stakeholders, if it happened during the crisis, the financial crisis, maybe they have some answers or they may reply to your questions in a way. And if we change it now, or if you do the interviews at this moment, a little bit we are outside the storm, not really still inside. Do you think if you repeat the interviews now, things will change? Do you have any other outcome?
We like to move.
Okay.
Short answer, please.
I will conclude. Regarding already we started and we initiated our thesis before the crisis, end of 2019, but before the crisis. We conducted our interviews and our workshop were done during the crisis. Our Lebanese stakeholders emphasized on the importance of the economic evaluation guideline, and they consider that even within the crisis, it is the most important time. It is the perfect time to have our economic evaluation guideline. However, economic evaluation guidelines are essential even before with or without a crisis. It was developed and adopted and applied by all high-income countries, even those who are not passing or they are not facing any challenge or any economic challenge.
Thank you very much. We have to proceed. Thank you very much. And we move further to the last opponent, and I'd like to move to Dr. van Maastricht. She is Assistant Professor at the Department of Health Services and Research at our university, and I'd like to give her the word.
Thank you, Pro-Rector, dear candidate. First of all, I would also like to congratulate with this marvelous work you did, and also I would like to give my compliments to your promoters and co-promoters. I really enjoyed reading your thesis, and I saw already 4 of the 5 papers are published in journals, so congratulations also with this. But of course, I would like to ask you a few questions, and maybe also based on the discussions you had with the other opponents, I would like to hear from you. What do you think? It's really time-consuming to develop such a guideline for one country, and because there are so limited resources available in low and middle income countries, would it not be more efficient to develop a guideline for a region? And what would be the disadvantages or the advantages to do this or to take that approach?
Thank you, esteemed opponent, for your feedback, and thank you for your questions. First, you asked about if we can apply, and it's time-consuming to develop economic evaluation guidelines. I will answer the first part. Surely it is time-consuming, especially regarding the systematic reviews. What is important that from now, for middle-income countries, already we have this part done, which is great. So for other middle-income countries, a large part of this development process is already done. The systematic reviews were the most longer part of this thesis. Regarding if we can adopt other economic evaluation guidelines, based on a literature done about adopting other economic evaluation guidelines, several studies show that the majority of the health economists did not conduct economic studies because of the lack of a national health economic evaluation guidelines. So the need to have a national economic evaluation guideline is a necessity, because a health economist will not adopt other international guidelines. Plus, another study conducted about the ITSE reference case showed that even that the Bill and Melinda Gates already developed a reference case for middle-income countries, low and middle-income countries, these countries didn't adopt this reference case. So we are always in need to develop our national economic evaluation guideline. Time-consuming, one of the steps are already done.
Okay, so brings me back to your reviews. I not fully agree that you don't have to do the reviews again if you want to develop a new guideline for a specific country. Could you maybe explain what should be done still if you would develop a guideline for another country, and what kind of literature review still needs to be done?
They have to do an update of the systematic review without conducting the whole systematic review. As you can see that in our 2 systematic reviews, between the first one and the second one, 2 countries already updated and developed their guidelines between 2021 and 2022. So surely each country should update this systematic review, but it will be easier than starting by a search strategy, searching for all the evidence. We have the majority of the evidence. We can update this systematic review.
Mm-hmm. And only updating, or could you also still improve something about the methodology you used to do these reviews?
We follow the preferred reporting items for systematic and review for the systematic reviews and meta-analysis. Our systematic review, our 2 systematic reviews were well conducted. Surely it could happen. We could have limitations, and we could have missed some of the guidelines, limitations for all systematic reviews, but it is well structured and well developed, conducted systematic reviews.
Mm-hmm. And were there maybe in the searching for the studies things you could have done differently or better?
Nothing still.
No.
Nothing.
What about the selection of the title and abstracts in the first stage? Who did this?
I did it.
You did it by your own, or was there somebody else involved as well?
Surely the guideline development group. It was done in duplicates.
Okay, I thought I saw in one of the papers mentioned that one person selected the title and abstracts.
The guideline abstract.
Yeah.
Yes, I did the full text screening, and the data extraction were done in the duplicates. But regarding the selection of the paper, it was done by me.
Yeah.
Yes, exactly.
And also this step is recommended to do with...
To be done in duplicates.
Yeah.
Thank you for emphasizing on this point.
Yeah.
Thank you.
Who asked?
And as you noticed, the beater was here exactly on time. She finished it, so she is really well prepared. Dear Miss Daccache, the time appointed for defending your thesis has now officially passed. The degree committee will now discuss not so much the quality of your thesis that has been discussed, but the way you have defended your thesis this afternoon, and we also take into account your presentation which you're giving this afternoon. I request that you and your company, who is here, leave this room so we can start our deliberation, and the beadle will come and collect you to return to this room. Thank you very much.
Thank you, Director.
Ladies.
Please, please.
Voor wat het uur is, om 5:30, ja.
Please be seated.
Bye.
Dear all, dear Miss Candidate, dear Miss Daccache, the degree committee here present has assessed the quality of your thesis, but more particularly the way you have defended your thesis, and also the presentation which you have given this afternoon to our committee. In view of its positive verdict and taking into account your previous qualifications, the committee has decided to grant you officially the degree of doctor. And I see your big smile, so you must be quite pleased about this.
Thank you.
Professor, and I think it's not correctly written here.
Professor Hillichman.
Exactly. It was Evers here, but that's not correct. Professor Helixman is authorized to confer upon you this academic distinction in according to Dutch university customs, and therefore I invite your supervisor now to take the floor.
Please all rise.
Do you promise to work in accordance with the principle of scientific integrity at all times, to be careful and honest, transparent, independent, and responsible?
Yes, I promise.
By the authority vested in us by law and in conformity with the decision of the committee here present, I hereby confer upon you, Caroline Daccache, the degree of doctor and grant you all rights attached by custom and law. As evidence of this, I now present you with the degree certificate signed by the rector, the secretary, and the other member of the committee, and affixed with the official seal of the university.
Yeah, so is better.
Very good.
Maybe even could do the whole team together.
Yes.
Promotion team.
Or then maybe online.
Yeah, you can do that in a while.
Okay.
Very good.
Okay, very well. And I give the word to Professor Karam to speak out the laudatio.
Please, may I ask you to be seated? Yes, you can give it to me.
Dear Caroline, it is with deep pride and sincere emotion that I deliver this laudatio on behalf of your supervisory team, Professor Sylvia Evers, Professor Michael Henningsman, Dr. Rana Rize, and myself. Passion and dreams are like time. Nothing can stop them. Caroline, your story reflects the very essence of this truth. Every step of your journey has been driven by passion, guided by purpose, and powered by the courage to dream, no matter the obstacles. Today is not only a moment of academic recognition, but also a celebration on unwavering determination, intellectual honesty, and depth of character. Caroline, your path to this PhD has been marked by perseverance, moral clarity, and a profound dedication to excellence. Witnessing such a rare fusion of scientific precision and human grace has been a true privilege. I first met Caroline as a student in the master's program in market access of health product at the Lebanese University, and from the outset, you distinguished yourself through your diligence, a sharp analytical mind, polite demeanor, and a refined sense of professionalism. Over the past 5 years, you committed yourself to your PhD with remarkable focus. Your work reflects academic rigor, patience, discerning analysis, and a continuous drive to grow. Your research addressed critical questions in health economics through the development of a national health economic evaluation guideline tailored to Lebanon, a country in urgent need of structured, evidence-based approaches to guide scarce health resources allocation. Working with you was not just a scientific collaboration, but an enriching academic journey. You consistently demonstrated humility, openness to guidance, and a strong adherence to academic values. Your discipline and sense of responsibility were steady and admirable. What makes you even more outstanding, Caroline, is your conscious decision to stay and serve in Lebanon at a time when many choose to leave. Your success is not only a personal triumph, it also stands as a symbol of national commitment, tenacity, insight, and a vision for a brighter future rooted in public service and devotion. And if I may borrow Shakespeare's word, uneasy lies the head that wears the crown. Indeed, to succeed as a wife, mother, manager, teacher, and scholar is not easy task, yet you wear this crown with serenity, resilience, and distinction. Caroline, you have not only earned the title of doctor, but you have also gained our deepest respect and admiration. Please accept my warmest congratulations and those of your entire supervisory team. I also extend my congratulations to your husband, Carlos, your wonderful children, Alex and Celia, as well as your parents, relatives, and friends, all of whom are certainly filled with pride and joy as they celebrate this moment with you, whether present here or online. They are fortunate to have you in their lives, just as we, your mentors and colleagues, feel privileged to have walked this path with you and to witness all that you bring to the academic and professional world. Dr. Caroline Daccache, may your light continue to shine for yourself, your family, your beloved country, and the many generations you continue to empower and inspire. Congratulations.
Well, dear Dr. Daccache, also the congratulations on behalf of Maastricht University, our board of directors. And in my congratulations, I also like to bring forward your promotion team. Also the doctor here online. I noticed from your thesis you started in 2019. And during that time, they reached this point which culminated today in this defense, and you did a great job. We all were very positive. We all were very positive about your presentation and the whole atmosphere. And my congratulations. I also would like to thank in my congratulations here the members of the Corona. It was already mentioned by Dr. Kamar. It takes some time to prepare. You just have 9 minutes, but it takes more than 9 minutes in preparation to finish this and to really read the thesis and make some appropriate questions. And I would like to thank also the members in Lebanon, all of them here who are online. We make a picture later, that they have found the time to join us today. Unfortunately online, but they are still here and we enjoy this. Thank you very much. And my congratulations to your husband, I notice here. So congratulations to the family. But I also look in the camera here because it's an online event. And I know I see in the green light that the camera is not looking to me. That's the way it moves here. I would like to congratulate also your family in Lebanon, your children and the rest of the family. You did a great job. And I think it's really time now to celebrate. And to celebrate, first, I have to close this ceremony, and for closing the ceremony, I'm going to use officially my hammer. So the ceremony is closed, and we will have the opportunity now to congratulate you, and we're going to do this in the old library, which we call it over here.
Okay? Can I ask the two of you to